World Global Health Issues, today, June 27. As you have seen in the media advisory that has been sent to you, we will have a special update from a WHO Scientific Advisory Group for the Origins of Novel Pathogen, or SAGO. We will have with us the chair of SAGO, and Dr. Tedros will introduce her in a minute. I will now introduce our guests here, our speakers, who will be answering your questions. Obviously, with us is Dr. Tedros Adhanom Ghebreyesus, WHO Director General. With us is also Dr. Mike Ryan, Executive Director of WHO Health Emergencies Program and Deputy Director General. Maria Van Kerkhove is, Dr. Maria Van Kerkhove is the Director ad interim of Epidemic and Pandemic Threat Management. We have also with us Mr. Nabil Tabal, who is Incident Manager within WHO Health Emergency Program. Dr. Kate O'Brien is our Director for Immunization, Vaccines and Biologicals. We also have Dr. Teresa Zakaria, who is the Unit Head of Humanitarian and Disaster Action. We may also have some other WHO experts and speakers, if need be, to answer some of your questions. With this, I will give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. Today, WHO is publishing the report of the Scientific Advisory Group for the Origins of Novel Pathogens, or SAGO, on the origins of COVID-19. We're honored to be joined today by SAGO's chair, Dr. Marieke Venter, who will present SAGO's findings in a few minutes. But first, some updates on other health issues around the world. WHO welcomes the ceasefire agreed between Israel and the Islamic Republic of Iran, and we hope it holds. Iran has reported more than 600 deaths and 5,000 injuries, and Israel has reported 28 deaths and more than 3,200 injuries. Between the 13th and 25th of June, WHO has documented 9 attacks on health in Israel and 5 attacks in Iran, impacting health services and causing deaths and injuries among health workers and patients. WHO will continue to work with Israel and Iran, including monitoring radiological and nuclear risks. This week, WHO participated in nuclear emergency exercise organized by the International Atomic Energy Agency to test emergency preparedness and response capacities and identify areas in need of improvement. Meanwhile, in Gaza, the situation is beyond catastrophic. Only 17 hospitals are functioning even partially out of 36 across the Strip, with no hospitals operating in the north of Gaza or Rafah. In the last 2 weeks, 500 people have been killed while seeking food aid at non-UN militarized food distribution sites and routes, resulting in a surge in injuries and taking a severe toll on hospitals in Gaza City as fuel, water, and medical supplies are depleting fast. Meanwhile, hunger stalks everyone, making them weaker, sicker, and more vulnerable. Since the start of this year, an average of 112 children have been admitted every day for treatment of acute malnutrition. In recent days, WHO managed to retrieve fuel supplies from our warehouses to support hospitals. Over the past few months, WHO has supplied over 1.7 million liters of fuel to health facilities, ambulance service providers, and partners. This week, WHO delivered medical supplies for the first time since the 2nd of March, with 9 trucks carrying essential medical supplies, including blood units. These supplies will be distributed to priority hospitals in the coming days, and more are en route. But it's only a drop in the ocean given the immense health needs. Since the conflict began, WHO has supported the evacuation of more than 7,300 patients from Gaza Strip. But since Israel's blockade began on the 18th of March, we have only been permitted to evacuate 294 patients, a tiny proportion of the more than 10,000 people who still need medical evacuation. WHO thanks Italy, Jordan, Saudi Arabia, the United Arab Emirates, and the United States for receiving evacuated patients. WHO calls for access for food, water, fuel, medical, and other aid at scale through all possible routes. Now to Sudan, the forgotten crisis. The ongoing civil war means people are dying from a lack of access to health services and medicines. Ongoing fighting has displaced more people than in any other crisis in the world. Health facilities are either out of service or only providing limited care. And diseases are spreading fast. Cholera has spread to all but one state of Sudan, with a worrying spike in Khartoum state. With WHO support, the Ministry of Health completed a 10-day cholera vaccination campaign that reached more than 2 million people in Khartoum state, and we're already seeing signs of improvement. WHO and partners are stepping up the response in other states and exploring options to strengthen the response in the inaccessible states of Darfur and Kordofan through delivery of critical cholera supplies, vaccines, and medicines. Just last week, the Al-Mujlad hospital in West Kordofan was attacked and 40 civilians, including children and health workers, were killed. I urge the world, do not forget the people of Sudan. Humanitarians and civilians must be protected at all times. We need urgent funding and we need access to make sure people receive the health care they need. And above all, the people of Sudan need peace. On Wednesday this week, I was in Brussels for the replenishment of the Gavi Alliance. Vaccines are among the most powerful innovations in history. In 1974, WHO founded the Expanded Program on Immunization, EPI, to harness the power of vaccines for the world. Since then, EPI has helped to save about 154 million lives. Since 2000, under 5 mortality has dropped by more than half globally, thanks largely to the power of vaccines and the work of Gavi. So I was very encouraged that donors pledged more than $9 billion to support Gavi's work over the next 5 years. In addition, Gavi implementing countries are investing a record $4 billion in their national immunization programs over the next 5 years. This is very positive news at a difficult time in global health, with drastic cuts in aid and mis- and disinformation about vaccine safety. Protecting children from life-threatening diseases takes more than just vaccines. It takes trust. It's important that parents, educators, health workers, and community leaders understand vaccine information clearly. When people know the facts, they can make better, more confident decisions. False claims and the distortion of scientific evidence are dangerous. For WHO, vaccine safety is central to our decision-making. WHO looks forward to its continuing partnership with Gavi to build on our success and reach more children with more vaccines faster than ever before. Now, returning to our main subject today, the SEGO report on the origins of COVID-19. The COVID-19 pandemic was the most severe health emergency in a century. It left an estimated 20 million people dead, wiped at least $10 trillion from the global economy, and caused enormous social and political upheaval. And we cannot talk about COVID-19 in the past tense. Although the crisis has passed, the virus remains. It continues to evolve, continues to kill, and millions of people continue to live with post-COVID condition or long COVID. The pandemic taught the world many painful lessons, and over the past 5 years, WHO, our partners, and many countries have put in place many initiatives in response to those lessons. We established the WHO Hub for Epidemic and Pandemic Intelligence in Germany, the mRNA Technology Transfer Program in South Africa to boost manufacturing in the South, the Global Manufacturing Training Hub in the Republic of Korea, the BioHub here in Switzerland, the Interim Medical Countermeasures Network, the Global Health Emergency Corps. Together with the World Bank, we established the Pandemic Fund and more. As you know, at the World Health Assembly last year, WHO member states adopted a package of amendments to the international health regulations, and last month, after 3.5 years of intense negotiations, they adopted the WHO Pandemic Agreement, a landmark instrument of international law to make the world safer from pandemics. Over the past 5 years, we have learned a lot about COVID-19, but there is one crucial question about the pandemic that we have not yet answered: how it started. Understanding how any outbreak, epidemic, or pandemic starts is essential for preventing future outbreaks. It's also a moral imperative for the sake of those who lose their lives to them. In late 2020, the World Health Assembly gave WHO the task of studying the origins of COVID-19. In 2021, I established the Scientific Advisory Group for the Origins of Novel Pathogens, or SEGO, an international multidisciplinary panel of 27 independent experts. SEGO was established with two core mandates. First, to develop a framework for the types of studies that should be performed to understand the source of emerging and re-emerging pathogens with epidemic or pandemic potential. SEGO completed this first part of its work last year. The second part of its mandate was to take forward the study of the origins of COVID-19, which it has been doing in parallel with the first part of its mandate over the past 4 years. Today, WHO is publishing SEGO's report, and I would like to invite SEGO's chair, Dr. Marieke Venter, to present the findings. Dr. Venter is Distinguished Professor and Research Chair for One Health, Surveillance and Vaccines at the University of Witwatersrand in Johannesburg, South Africa. Sorry about the name, but I think you will understand. Witwatersrand. Marieke, you have the floor.
Thank you, Dr. Tedros. Good afternoon, good morning, good evening, ladies and gentlemen. So I would like to tell you about the SEGO independent assessment on the origins of SARS-CoV-2. So our focus is really the science, so I would